Vaccines, variants, masks, and mandates. You've sent us your questions. Now live from Palm Springs, News Channel 3 brings you Coronavirus Questions Answered, presented by the Desert Healthcare District and Foundation.
Good evening, everyone. I'm Peter Doubt. We are coming to you live tonight from the Desert Healthcare District and Foundation headquarters in Palm Springs for a special edition of Coronavirus Questions Answered. We have assembled a team of local healthcare experts to answer your questions about the vaccine and also mask mandates and looking ahead to 2022. A lot of people want to know what's happening now that the pandemic is almost 2 years still going, and we have received a lot of your questions through email and also through our phone bank. Before we get to those questions, though, I'd like to introduce our panel. We have Dr. Conrado Barzaga, who is the Desert Healthcare District and Foundation CEO, Dr. Ali Zara Mendez, who is a hospitalist with Eisenhower Health, Dr. Constanza Burciaga Calderoni, who is a pediatric hospitalist for Desert Care Network and Loma Linda University Health, and Dr. Carmina Zavala. She is a registered psychological assistant and member of the Desert Healthcare District. These folks and other medical professionals will be answering your questions tonight and also through our phone bank, which we have set up. We have a team of people here answering your questions. That number is 760-449-5500. You can call at any point during this broadcast, and they will do their best to give you answers. Now, the mask mandate is the first topic we want to get to. That went into effect from the state starting today, and that means you have to wear a mask, even if it starts to fall off your face while you start to talk. And that is only for indoors, so that is regardless of vaccination status. So let's get to our first question. Take a look.
Well, we're curious to know why we are going back to the mask mandate.
What's the purpose of going back to the mask mandate when you can walk into any restaurant? You have to have the mask to walk in, and as soon as you sit down, you take the mask off.
All right, Dr. Barzaga, the first question we'd like to know, why is the mask mandate needed even among those who are vaccinated?
The mask mandate is necessary because the mask is the most important physical barrier we have in our mouth that prevents saliva with virus to go from my mouth to the air, and then somebody else can breathe in and get the virus. It is important that we use this barrier. It's very simple, and we know it works.
And we know it works. All right, do you think that masking will continue to be the norm going into the future?
I believe masking is necessary right now because we see an increase in the cases that we are seeing with COVID-19. The more we see people getting vaccinated, I believe the less is going to be needed to be masked.
All right, thank you, Dr. Barzaga. Dr. Mendez, if you could join me now. Speaking of the new normal, we want to turn to some of the questions our viewers sent us about booster shots and the coronavirus vaccine. It has now been 1 year since the first vaccines were given here in the U.S. The question is, will we need to get the coronavirus vaccine each year?
Well, at this point, it is impossible to say how much time the vaccines are going to offer protection. However, I think the most important part right now to do our part as a society is to get vaccinated and see how much it lasts, and we go from there.
All right, let's get to the next question. If I had a strong reaction to the first 2 doses of one of the vaccines, is it safe for me to get a booster shot?
And that question depends mostly on the severity of the reaction. There are different types of reaction you can get. A severe one that is life-threatening that can present with difficulty breathing, rash all over your body, and other issues that can provoke issues in your health. And there's a local reaction. If you have a local reaction, then what would happen at that point is that you can actually try the other arm and it should be safe. But if you have a severe reaction, you should follow up with your primary care provider and ask if it is safe to get the next dose.
Ask it if it's safe. All right, we have a question from local resident Shirley Allen. She wants to know, if we have had the Pfizer vaccine plus the booster, would it be wise to get one of the other vaccines too?
That's a good question. At this point, there is no indication that if you receive the 2 doses plus your booster vaccine that you need to combine any other vaccines, as this may not offer any extra protection at the time.
Okay, resident Amy Raff wants to know, I had a recent antibody blood test showing high antibodies, so do I need to get a booster?
The antibody titers have not been shown to be predictive of how much protection we have. So in reality, getting the booster, I think, is the most appropriate thing, regardless of what the antibody titer is.
All right, next question. Are most of the people hospitalized with COVID unvaccinated?
Absolutely, yes.
Absolutely, yes. Can you give me a percentage?
Well, it's been mostly about 90% of people that are in the hospital are unvaccinated
90%.
with a severe disease, correct.
Oh, wow. Okay, that's staggering. Thank you, Dr. Mendez. Again, folks, you can send your questions in any time through our phone bank. That number is 760-449-5500. And here's some of our panelists who are answering phones right now, including Dr. Jorge Cervantes. You're the Chief Medical Officer with Borrego Health. Can you tell us some of the questions that you received tonight from viewers?
Yes, thank you so much. We've so far been asked a lot of questions about allergies. Had some patients ask, can I get a COVID vaccine if I have allergy to penicillin? The answer is yes. If I have allergy to pollen or to other antibiotics, the answer is yes. I've had patients ask if they can get a vaccine while they are pregnant. The answer to that is yes as well. Patients asking if they need to get another booster or another type of vaccine. Specifically against the Omicron variant, that's something that we don't currently know. What we do know is, as Dr. Mendez mentioned, that you need to get your 2 doses and your booster based on the information that's coming out there. That's what people have been asking so far.
So interesting variety of questions that we've been getting. I want to introduce our panel here who are answering the phones tonight. We have Henry Nosovitsky. He's the physician assistant with Borrego Health. He is the Borrego Health COVID-19 Vaccine Task Force Chairman. We also have Lindsay Valenzuela. You're the Associate Vice President of Population Health Integration with Desert Oasis Healthcare. So again, if you have questions, you can call the number on your screen. That is 760-449-5500. And coming up on this special live edition of Coronavirus Questions Answered, we're going to get to more of your questions, including more on variants and the impact on children. Stay with us. Welcome back, everybody, to this special edition of Coronavirus Questions Answered. We are coming to you live tonight from the Desert Healthcare District and Foundation headquarters in Palm Springs. Joining me now is Dr. Constanza Burciaga Calderoni. She is a pediatric hospitalist for Desert Care Network and Loma Linda University Health, here to answer some questions involving children. All right, Dr. Calderoni, this is from resident Fran Lopez. How safe is it to have your 5-year-old child who has received both vaccines in a classroom with unvaccinated children?
So we have to remember that the vaccine does not prevent us from getting COVID-19. However, it does prevent kids and adults from getting severe disease or being hospitalized. So I believe that if the kid's already been vaccinated, they have a pretty good chance at, staying out of the hospital or developing severe disease.
Still focusing on the classroom, how do we keep younger children who can't get the vaccine safe while older siblings attend school?
So this is when other manners of preventing COVID-19 come into play. So we have to keep using our masks as we can still transmit and get the disease. We need to wash our hands. We need to keep social distancing. In the classroom, it's important that the area remains well ventilated, that we reduce the amount of time that we stay in enclosed environments. But if the kid is vaccinated, we have also seen that when you're vaccinated, you are less likely to transmit the virus because you have lower viral loads and you remain infectious for a lesser period of time. So I believe that if you're vaccinated and you do all of these things, you can still keep your other kids safe.
You can still keep your other kids safe. All right. Now, this pandemic has certainly been stressful on many of us, especially children. So what advice, Dr. Calderoni, do you have for parents who are trying to help their kids understand the pandemic?
That's a difficult question. I think even though we've seen kids be physically affected less than adults, the psychological and emotional stressors in kids has been massive. We have seen a huge rise in psychological and psychiatric conditions in kids. So I think as parents, we need to make sure that we remain calm, that we don't panic, and that we show that calmness to our kids, that we remain, a strong family unit, and that we can, educate our kids as well and make sure that they remain safe as well.
All right. Thank you, Dr. Calderoni. No problem. And you'll be answering more questions for us coming up. And, of course, we have a lot more to get to on this special edition of Coronavirus Questions Answered. Coming up, we're going to be talking about variants, including the question, is the Omicron variant more contagious or severe than the others? Stay with us. We'll be right back.
I think we're all waiting for answers on the new variant.
The variants? I feel like the variants have been way overblown, and I'm more concerned about the flu at this point.
I think I'm just very concerned about the mutations and how they come in, and the latest one as to how the effect is going to be. I don't think anybody knows for sure.
All right, we're back answering more of your questions about the pandemic. I'm joined once again by Dr. Barzaga, who is the Desert Healthcare District and Foundation CEO. Let me ask you, Dr. Barzaga, is the Omicron variant more contagious or severe than the others?
Well, there are two parts to that question. One is, it's more infectious. The answer is yes. We have seen in some areas that Omicron is replacing the Delta variant to the tune of about 20%, very fast. And what we have also seen is that it's less severe in terms of the disease that it causes. Now, there is an interesting question here. Is it less severe because we have more people vaccinated and the vaccine is giving us some level of protection against the virus to make a lesser grave disease? So that might be the case.
Safe to state, we're learning more about these variants
We
each day.
continue to learn more about this virus, this variant, every day.
Let me ask you, sir, will the booster protect against the Omicron variant?
What has been seen so far is that the booster is providing adequate protection against the Omicron.
Are there other variants right now that are causing concern, and why are some more concerning than others?
The reason that we have variants, as you know, it goes into different bodies, people that are not being vaccinated, the virus gets there, it mutates, it becomes stronger, and then comes out and comes back to hunt you. What we have seen in terms of variant, there are 5 of concern. The one that is most concerning right now is Omicron. The second one is Delta. Delta because it's very aggressive, it causes very severe disease, and Omicron because it transmits itself very fast.
And do different variants impact children different than adults?
I believe that is the case. We saw with the Alpha variant that it was the older population that was mostly affected by the first wave of coronavirus. We have seen with the Delta variant that many children have been infected. We actually have had high mortality in some cases among children and younger adults. We don't know with Omicron what's going to happen right now.
Okay, and finally, with more variants of the virus, should people who are vaccinated get tested regularly?
Absolutely, because you can get the virus and have no symptoms, and while you have the virus with no symptoms, you can go out into the community and transmit the virus to other persons that are healthy.
All right, thank you, Dr. Barzaga. We want to transition now and talk about holiday travel. Many of us are heading home for the holidays, and with new mask rules and variants of the virus, there are a lot of questions. So let's bring up Dr. Mendez. Thank you again for joining us. The first question is, I am traveling to see my family for the holidays. How soon before and after should I be testing? And what kind of test do you recommend?
Well, right now the recommended test if you're vaccinated is to get the PCR test. That's been shown to be the most accurate one. How soon is a really difficult question. As we know, you could be tested 2 days before and the day after be exposed. And most people don't get symptoms up to 4 to 5 days after the incubation period, if that makes sense. So the best answer would be to be tested probably the day before you go see your family.
The day before. And after?
And after, when you come back from seeing your family, probably a day after you would be able to get an answer.
Okay, so immediately almost. And also, is it safe to visit family members who have not had their booster shots?
Is it safe to see? Well, that is a very difficult question to answer at this point. I would say to take precautions if they have not had the booster vaccine. As we know, when you get a vaccine, up to 6 months later, you can see a decrease in the efficacy of the vaccine. So let's say you got a vaccine and then 6 months later you're going to see your family and they haven't had the booster, then they may be at risk. So I would say in this kind of circumstance, it would be appropriate to wear our masks, even if we're with our family, to try to prevent and transmitting this disease.
Sticking with travel, what is the best way to protect myself on a plane? Do I need to double mask?
Well, some studies from the Journal of the Medical Association have shown that if somebody wears a surgical mask of this quality that we're wearing right now and adds an extra cloth kind of mask on top of it, you can reduce the transmission rate for about 95%. And to make sure that you're surrounded by people that are also wearing your mask is going to confer the extra protection.
All right, thank you, Dr. Mendez. Switching now to the pandemic's impact on mental health. Take a look at this question.
Now we're seeing great impact on our young people, on suicide rates, on depression rates, on counseling, things like that. And it seems like they are only paying attention to the health officials, but I don't think they're taking into consideration into the negative effects of some of those requirements.
All right, I'm joined now by Carmina Zavala. She's with the Desert Healthcare District and Foundation. You're a board member, and you're also a registered psychological assistant and a candidate in applied clinical psychology. That's a mouthful.
Yes, it is.
All right, so let me ask you, in terms of mental health, what can we do to deal with masks and mandates?
Well, one of the things that we can certainly do and deal with is continue to wear the mask and also to keep social distancing to protect ourselves and others from COVID and others.
Yeah, and what can our viewers do to identify and help other people, including family members, who may be having mental health impacts?
Okay, so certainly one of the things that we can do when one of the things that we can certainly do is when we're see a family member either isolating or not being socially connected with family or friends, is important to make recommendations to maybe seek mental health services.
Help make recommendations. All right, thank you so much, Carmina Zavala. We appreciate it. Coming up, we're still not over. We're going to ask each of our experts what their predictions are for 2022 in terms of the pandemic. Stay with us for the special edition of Coronavirus Questions Answered.
I think it's going to go away. I think by 2022 it's going to start fading out and it'll just be like a flu, basically.
And what do they think is going to happen next? Do they see something else coming? I would ask them that. Do you see something else coming around the corner that we should maybe know of and not start living our lives like we were in, 2019?
Of course, it's impossible to know for certain, but a lot of viewers have questions about what to expect for the pandemic in 2022. So I want to ask each of our experts your thoughts. What do you think we can expect for the new year?
Well, for the new year, we will see if people do not accept the vaccine. We will see new variants and we will see an increase in the number of cases. If we see people accepting the vaccine, taking up the vaccine, we will see less cases and, of course, less mortality, which is going to be a wonderful blessing for our community.
Certainly. Dr. Mendez, your prediction?
My prediction would be that if we all do our part as a society and get the vaccine and take the measures of protection, as a hospitalist, I hope that my prediction is correct, that we're going to reduce the amount of people that are hospitalized and therefore reduce the amount of people that die from this disease.
Come on up, your prediction.
Well, making a prediction would be hard, but my hope would be that we would be able to reduce severe disease and hospitalization in children as the vaccines start rolling out.
Okay, and finally, Carmina, what are your predictions in terms of mental health?
My prediction is that the anxiety will still be elevated, so it's really important for us to seek mental health services if we notice that the anxiety gets elevated where we can't control it.
Some great answers there. And thanks to all of you for being here tonight and answering all of our viewers' questions. Again, the phone lines are still open, 760-449-5500. Thank you to the Desert Care Network, the Desert Healthcare Foundation for having us here tonight. I also want to thank Dr. Conrado Barzaga, Dr. Constancia Burciaga Calderoni, Dr. Alizade Mendez, and Carmina Zavala. You all have been so informative, and we appreciate your time. And of course, you can continue our coverage of the coronavirus by heading to our website, kesq.com. And always send us your questions to coronavirus@kesq.com. And again, the phone lines are still open. Our folks here are answering more of your questions, and we'll continue to get you answers on the coronavirus. I'm Peter Doubt, coming to you live tonight from the Desert Healthcare District Foundation and headquarters here in Palm Springs. Thank you so much. Falling, but there it is. Thank you so much for joining us for this special live edition of Coronavirus Questions Answered. Stay safe, everybody. Have a great night.